Welcome back, everybody, to another edition of the OAO Member Spotlight. And once again, I'm happy to welcome back Dr. Angela Yoon to the show. Welcome, Angela.
Thank you for having me.
So, Angela, you practice in Scarborough, Ontario, and you also work part-time at OAO as a policy consultant. One of the biggest files that you work on a day-to-day basis is the OAO TPA web app, launched in October 2014. So let's call that TPA web app 1.0. The topic for today's show is to go over the new functionality that has been added to the app. So we'll call that TPA app 2.0. So Angela, if you can maybe run our listeners through some of the functionality that's been added in the second release of this application.
So in addition to being able to search by name, product category, whether there's a generic available, and drug benefit formulary inclusion, we can now search by drug format. So if you're looking for drugs that have a liquid formulation, you can do a search based on that. You can also search based on special populations. So for a child in your chair, if you're looking for on-label indications, you can pull up those drugs. Also for nursing mothers, you can look for drugs that are safe for those populations. And also you can pull up and search drugs based on whether they have preservative-free formulations. Here, if you're looking for oral drugs that have a suspension formulation, you can pull up all of the drugs that we can use in Ontario. If you click on, for example, clavulin, there's more information now on special populations. You can click on pediatric dosing guidelines, for example. And there are more extensive notes on drug interactions and adverse effects. We also now have new categories, mostly OTC products. Those include oral antiallergics and NSAIDs, as well as topical lubricants, antiallergics, and vasoconstrictors.
So Angela, maybe you can run through, show the group, say I want to prescribe a non-preserved anti-glaucoma medication. Can you show us how we would search for that?
Sure. So you would press glaucoma agents from the category section, and from the preservative-free, you would just press yes, and then search. So these are the three that are available to prescribe in Ontario.
So can you click on TrueSoft at the bottom? And what happens when you click on the image on the right-hand side? Okay.
Well, you can scroll. There's more than one picture that can be pulled up now compared to...
There's the preservative-free format right there.
Yes.
Angela, maybe if you could do one more search, say like an oral antibiotic like clavulin.
Okay, sure. You can just go down to the category. You can pull up all of the oral antibiotics, or you could, if you're looking for that drug specifically, you can just type it into the first search box.
Right, but here you can scroll down and find it.
Yeah, if you want to compare the options available, click on clavulin, and here you can see more detailed information on all the different preparations available, typical adult dosing, more information on pediatric prescribing. So if you click on the link, it'll give you weight-based dosing for pediatrics. And the new aspects include more information on drug interactions and adverse effects.
And of course, another piece of functionality that I think has always been there is the drug formulary piece.
That's right. So if you wanted to see what's available, what's covered, you can just click and go directly to the Ministry of Health's drug benefit formulary.
That's great. Maybe I'll get you to do one more search, maybe an age-based search. So say you have a 3-year-old or a 4-year-old child in your exam room and you want to find a medication, say like an antihistamine or something that's safe for that age group. How would you search for that?
Good question. So what you would do is just go to the product category, press anti-allergics, and you can type in age 3, years.
And then select the unit. Okay.
That's right. And these are all the on-label drugs available for that patient.
Perfect. Great. No, thank you so much for adding all this great functionality. I know we had great reviews when we first launched this app about 18 months ago. And version 2 has added almost double the functionality of the application. Maybe you can also let the viewers know what's happened sort of nationwide with OAO's TPA app.
Well, Jeff, we're almost pan-Canadian. We've got all of the Western provinces pretty much launched this month, and we're working on Quebec at this time, which will be a little bit more work because of the translation aspect.
Yes.
And after that, we'll have the Atlantic provinces.
Perfect. Any thoughts on other things that you'd like to add? Anything else on your wish list that you're thinking about?
Well, there's been no shortage of suggestions for the next set of upgrades, but there's 2 that I like. One is a way to notify users of changes that happened since the last time they've logged in. So if a drug was added or discontinued, the user can easily see what the changes are. And
Right.
another one that I like is a weight-based calculator, which would be useful in pediatric populations.
Right. Okay. And folks can always email OAO if they have any suggestions on future features. I guess the goal is to, now that this is pan-Canadian, the goal is to, update this with the increased functionality as we move forward. So maybe I'd just like to finish off with a quote. And I found this interesting. A couple months ago, I was in Windsor, Ontario, giving an update to a regional society of OAO members. And one of the members there, Dr. Bradley Sanger from Harrow, Ontario, basically said that the TPA app, that one sort of value add for our membership, was worth the entire price of his OAO dues. And I thought that was quite the quote. So thanks, Angela. Thank you for taking time to update the members on the new features of the OAO TPA app. We'll put some links in the show notes on how to access the app, a video that members can watch if they have trouble logging in the first time. And you can always email or phone the association if you have trouble getting in. Okay. Thanks, Angela.
Thanks for having me.